Joining us now is Dr. Aileen Marty. She's an infectious disease expert at Florida International University. Thank you so much for being with us and taking the time for us tonight. The big question a lot of people want to know is, are we flattening the curve in South Florida, the state and the country?
We're doing a fairly good job here in South Florida now that the state has locked down and that more people are adhering to the concept of social distancing and wearing masks when they go outside. Many people have recognized that that is important, not just to their own health, but to diminish that curve for everybody else.
Dr. Marty, the lead researcher at the National Institute of Health said today they might be able to have a vaccine ready very soon. I'd like to play a quick soundbite with Dr. Kizzmekia Corbett and then get your reaction.
We're targeting fall for the emergency use. So that would be, for healthcare workers and people who might be in constant contact and risk of being exposed over and over. And then for the general population, our target goal is for next spring. And that is, if all things go well, and if these phase 1, phase 2, and phase 3 clinical trials work simultaneously for the good, our plan is to have people vaccinated all over the world by next spring.
Dr. Marty, what's your reaction to hearing that? How big would it be for our first responders to be vaccinated this fall?
Oh, it would be wonderful. I just don't believe that that's going to actually be the case because these studies take time, and this is a complicated virus that reacts with the immune system in very complicated ways. And while I certainly hope that that time frame is realistic, I don't think it is. I think it's going to take longer than that. That's the reality.
And even though the vaccine is really the ultimate solution, an effective treatment would also be a huge game changer. What kind of progress is happening on that front?
There's a lot of progress happening in terms of antivirals. Some of the early results coming back from some of the newer antivirals that have been tried have been very promising. A new result back on remdesivir looks very promising. And this is, when we think of antivirals, one thing is to talk about antivirals as a treatment. The other is, another avenue that we're pursuing is an antiviral as a prophylactic or as a post-exposure drug. If you take a post-exposure drug or a prophylactic, that would be the equivalent of having a vaccine in terms of being able to knock a virus out of the population. So we're looking at many fronts all at the same time, and we're working very cooperatively with scientists all over the world because truly this is an international problem, not just a problem for South Florida.
Dr. Marty, 2 days ago, the state surgeon general said that social distancing may be necessary for more than a year, but he didn't elaborate. What do you think about that prospect?
Well, I think what he's looking at is the reality that there is a constant flow of human beings. Plus, we know that this virus the SARS-CoV-2 virus can bind to the equivalent receptors in certain animals, and we're very concerned about whether virus can be transmitted to animals and how that might impact on the overall pandemic for humans. So there's a lot of questions that we're still working on, and he's being very cautious, and he wants to make sure that we have something in place that's going to protect people, such as a vaccine or, as I mentioned, one of these antivirals that could keep us, allow us to go back into normal society sooner.
And Doctor, today Abbott Laboratories announced it could be screening up to 20 million people for COVID-19 antibodies, as you were talking about, by June. How important is that?
Well, it's very important to look at the antibody reactions. We're going to be looking at IgGs and IgMs, and already here in Miami, in South Florida, the University of Miami, for example, is already on the move looking at IgG and IgM, screening for that. That's very important because it gives us an idea of who's been exposed who no longer has symptoms, and whether they've been exposed for a short time or a long time. That's the difference between IgGs and IgMs. But even with that, we have to be cautiously optimistic, because remember, just because somebody has developed antibodies is not certainty that those antibodies are good quality antibodies that are actually functioning to keep the virus down. We're still working to try and understand that aspect as well.
Dr. Marty, we've seen the hospital system in New York come under incredible strain. How do you see the picture as far as hospital beds, the ventilators, and everything else here in Florida?
Well, right now we have enough hospital beds. We're a little bit short on ICU beds, but the hospital administrators of our various hospital systems within South Florida have been working very hard since early March to try and increase their bed capacity. They've decreased the availability of kind of routine surgical procedures and more routine type of medicines to postpone it so that we can be ready for when we reach the peak here in South Florida. And I'm very proud to see that they've done a bang-up job. FIU has actually provided ventilators and shields in terms of PPE to some of the hospital systems here to try and help with the shortage issues that we have.
And Dr. Marty, I want to ask you before we leave, what do you make of the administration withdrawing funding from the WHO, the World Health Organization?
Well, the World Health Organization is something that belongs to all of us, including the United States. It was founded as part of the United Nations. And actually, it's a very complex entity. In fact, it works because of scientists all over the world, including at the Center for Disease Control, which is one of the collaborating centers for WHO. So when you take away money from WHO, you're also taking away money from places like the Center for Disease Control. It is and the WHO on the 14th of January had already spoken about specifically person-to-person transmission, and it was not WHO's role to say anything about when a country can or cannot impose travel restrictions. The role of the WHO is based on an international agreement signed in 2005 called the International Health Regulations. That regulation asks the WHO to ask a country that's imposing travel restrictions to please give the public health reason for doing so that they can explain it to other countries that are going to be restricted. That's the only role that the WHO has in terms of travel. So the reality is it's a vital organization needed desperately right now, not just for the world, for the United States, but for the entire world, particularly countries that do not have the resources by themselves to get rid of this virus. And until we recognize that this virus is actually a threat to every human on the earth, not just to citizens of one city or another, until we come together and we utilize this fantastic organization that we helped create, we, the United States, helped create, then we are simply not doing our best to get rid of this pandemic and to solve this horrific problem that all humanity is facing.
Okay, Dr. Aileen Marty from Florida International University, thank you very much, and we will